Hi there. My name is Diane Lapota from Diane Lapota Foundational Wellness. You can find me at dianelapotawellness.com. That's DIANELAPOTA wellness.com. Today I'm sharing my webinar called From Surviving to Thriving, Break Free from Chronic Pain, Fatigue, and Brain Fog to Reclaim Your Energy, Clarity, and Active Lifestyle. No guesswork, just results. I'm here to very briefly introduce myself, but I'm going to leave screen so that you can see my content better. See you on the other side. First, my legal disclaimer. This seminar is for informational purposes only. It does not establish a patient-provider relationship, establish a standard of care, or replace professional or medical judgment or advice, nor should it be used for diagnosing or treating any condition. Although I am a licensed clinician, I am not functioning in that role during this educational session or in any capacity of my business or coaching services. Welcome. Congratulations for taking your first step toward transforming your well-being and your life. The fact that you're here tells me that you are seeking a real solution to help you finally conquer your constant pain, fatigue, brain fog, frequent illness, sleep problems, digestive issues, or a variety of other symptoms that have been plaguing you. Some of you here have spent years in endless appointments with multiple specialists, primary care doctors, infectious disease specialists, rheumatologists, neurologists, orthopedists, chronic pain clinics, psychologists, chiropractors, physical therapists, and maybe even other functional medicine practitioners. You may have even been given antibiotics, antivirals, antifungals, antidepressants, anti-anxiolytics, steroids, sleep aids, IV therapies, and or pain management medications and interventions. You may have even tried multiple detoxes, supplements, stress reduction, and diet modification, but results have been inconsistent or not lasting. Maybe even all your lab tests are normal or close to normal, making it frustrating to have no real objective data to support your symptoms. Maybe you've been given labels like chronic Lyme, fibromyalgia, chronic fatigue syndrome, or long haulers, and received treatments to help quell your symptoms, but you never received anything to help you overcome your symptoms so that you could feel like yourself again. You were told it's just something you need to learn to live with and manage the best you can. But you still wake up every day not feeling rested, often struggling to get out of bed due to joint stiffness or fatigue. You barely have the energy to do the smallest of tasks, and when you do, you need to take frequent breaks. Sometimes you feel like you're living in a fog. Afternoons are the worst when any activity is completely exhausting. Work, hobbies, and social engagements have become difficult or even impossible. You feel frustration and guilt because you can barely care for your family, much less yourself. Everything is a mountain to you. Nights are especially bad when you can't sleep due to endless pain and anxiety, but you're so tired. In your head, you're thinking, I'm broken. My body has betrayed me. Or maybe it's just in my head. Let's face it, some doctors have already suggested that. Or I can't do this anymore due to exhaustion with no end in sight. Or maybe you're thinking, no one understands. This leads to pervasive isolation and feelings of being misunderstood and not heard. Or, why can't I get better? You're fearful that you may never feel better. In fact, you may even have a lot of anxiety that your health could deteriorate further. You may feel like a burden to others. You're frustrated by inconsistencies in opinions between your health professionals. You may even feel fearful of trying one more thing because of fear of another failure. You may feel hopeless, helpless, and powerless. All you want to do is regain your energy, mental clarity, and return to some semblance of normal life. Well, hope, help, and empowerment are here. My goal in this training is to teach you as much as I can in a short time that brings you to a place of hope and empowerment so you can get back to living a vibrant and active life. Now, I'm going to shift here for just a bit because perhaps you are the person who came here because you're exploring options for optimizing your well being, correcting minor imbalances, preparing for pregnancy, or preventing future problems. Well, stick around because all the same principles apply. The difference comes in the approach and timeline, which varies widely depending on your circumstance. Time is a precious commodity, and the last thing I want to do is waste anyone's time. So let me start by defining who this teaching is not for. If you're the type of person who has done all the research and think you already have all the answers, or you're stuck in your thinking to the extent that you don't want to allow for new information, then you're in the wrong space. The goal of my program is to stretch your mind and your body little by little, to challenge you within your comfort zone, to make small incremental changes that add up over time, to make profound wins. You need to be the type of person who's teachable and coachable. That being said, it's okay to have doubts. I'm here to earn your trust and help you overcome mindset blocks that may be preventing you from getting better. Today, I'm sharing with you all the basics you need to know in order to get started toward the end goal of a new life, including having all-day energy, clear thinking, and pain-free vitality. My goals in this teaching are to clearly share who am I, why do I do this, why should you, what is preventing you from getting better, what makes my program different, how this process works, including the specific sequence of steps to success. When can you expect to see results? Where will you be if you choose to work with me and my team? And I will add, where will you be if you don't? And finally, another how to get started. There's so much to discuss and you don't want to miss a thing. Hang with me, and at the end, I'll tell you how to access my 3 free gifts, including number 1, my free gift explaining why and how it's necessary to open up drainage pathways in the body and before detoxing. Number 2, an explanation of steps that need to be sequentially addressed in a foundational wellness program. And third, my essential oil guide called Symptom Support for Chronic Health Challenges. You're also going to learn how we will customize an individualized, relational, and immensely supportive program that creates long-term, sustainable results. Who am I? Who are we? Who are our clients? I'm a foundational wellness coach. What is that, you ask? I've been trained in functional medicine, but specialize even further in addressing the very foundations or the deepest root causes of ill health. I'm a certified Lyme specialist and a certified neurotoxic assessment practitioner. I've been in this space for almost 6 years, and previous to that, spent 37 years in the allopathic medical arena as a physical therapist with a broad range of experience and specialties. My teammate and health coach has been bringing folks with severe chronic health challenges back to a state of thriving wellness for 28 years. She's one of the best in the country. Between us, we have over 65 years of very diverse clinical experience. Together, we serve our clients with great success. For instance, client Betsy says, Diane addressed the root cause of my issues: systemic inflammation, joint pain, degeneration, and gut issues. She and her team devised a plan to systematically address my issues to allow my body to heal. They celebrated my highs and were empathetic and encouraging with my lows. So grateful to have them on my healing journey and be able to live my best life possible. My why. I'd like to tell my story of what brought me into this passion and calling on my life. In all my many past clinical roles, I've always given my utmost to provide comprehensive, individualized, and research based care. It's been especially important to me to be innovative and flexible in order to meet the goals and challenges of each individual under my care and guidance. The most important aspect of working with people who are in a vulnerable position due to acute or chronic injury or illness is developing a caring and trusting relationship. During my long, satisfying career, I've seen massive changes in the way healthcare is delivered. Much of the industry is now encumbered by productivity quotas, insurance restrictions, and pharmaceutical and big government influences. There's more emphasis on specialized care, which has its pros and cons. The greatest loss in this model is decreased oversight, focus on body systems instead of a fully integrated body, including mind and spirit, and often sufficient comprehensive oversight. There is a lack of advocacy for people who can't or don't know what questions to ask or how to best navigate that system. Because of strict productivity expectations and lack of training, little attention is given to diet, lifestyle choices, preventative measures, or search for root causes of chronic symptoms. Let's face it, none of these things can happen in a 7-minute visit with your doctor. Now, I want to recognize that some clinics and doctors are better than others in these things. The system is not built on a coaching model. There's almost no time or resources to counsel on a deep personal level, which is required to properly help someone in a chronic inflammatory state. Instead, medical management revolves around prescribing pharmaceutics that simply quell symptoms and bear side effects that can progressively lead to the development of other disease states. Think about it this way. If you have a sick plant that has turned brown or spotted, you're not going to make it better by painting the leaves. As I worked in allopathic care, I noticed that many of my elderly patients suffered the same cluster of preventable disorders and diseases. I started to notice that many of my patients, young and old, had multi-joint and migrating pain, such that it became obvious that they were not dealing with simple biomechanical dysfunction, but rather systemic challenges. Too many friends and colleagues with severe chronic symptoms of disabling fatigue, pain, and brain fog spent years seeing multiple specialists and got no answers. They looked fine and their lab tests were normal. How frustrating. How painful to see so many people suffering when I know there's so much more available for them. Always having been interested in more natural ways to approach health, I began a quest of education for answers to these issues. My goal is to be a change agent in the landscape of chronic illness. We need it so badly in this country. Now, when I was studying functional medicine, which seeks imbalances in the system, I began to recognize a gap in functional medicine as well. Witnessing too many practitioners using supplements in the same way that medical doctors prescribe medicine, giving a pill for an ill, albeit natural substances. They would do functional lab tests, which get closer to root cause, but each test is only a small window into the many complexities that lend to chronic illness. I don't have a problem with these tests per se, but many practitioners will treat to improve each functional test, peel a layer, and move on to the next functional test for further answers. This can become an endless process, and without insurance coverage available for these interventions, the costs can be staggering. One friend spent over $150,000 on the treatment of her symptoms by going to many different functional doctors before she was able to fully function again. We have to do better than that. In early 2020, I was introduced to actual root cause methodology and have spent all my time since mastering this knowledge. Pretty much every imbalance comes down to a toxic overload of the body. No matter what our GI tests, Dutch Plus or hormone tests, or organic acid tests look like, one still needs to deal with the toxicity. For instance, it's toxins that cause the good gut bacteria to pleomorph or change into unhealthy bacteria. So, if you do an elimination diet to heal the gut lining, get rid of the bad bacteria with a bunch of herbals, and take good pre and probiotics to replenish the good bacteria, but don't deal with the toxins, you may or may not have lasting results. It all depends on the individual. So let's talk about toxins. Did you know that the average woman puts 168 ingredients in or on her body each day? 85 for men, many of which are known carcinogens or otherwise toxic. What is preventing you from getting better? Our food is full of pesticides, herbicides, and non-nutrients. The air is polluted. Our soils are depleted and rife with chemicals. Our houses may have radon, mold, and toxic off-gassing from construction materials and textiles. Our drinking water is full of herbicides, chemicals, plastics, hello bottled water, and often radioactive elements. We are increasingly exposed to multiple viruses, vectors, and pathogens. Many of us are in a constant state of stress because of genetic, environmental, dietary, lifestyle, and psychological factors, including stress and stressful relationships. We each accumulate a set of toxic burdens within our bodies. Our systems were designed to naturally deal with these burdens, but all of us differ in our individual innate detoxification capacity and efficiency. An analogy would be to say that we each have a different size bucket or capacity to handle these toxins. Our bucket fills and our detox pathways naturally act to empty it. So you keep a balance if your detox pathways keep up with your intake of toxins. These toxins may not cause any noticeable havoc until our bucket suddenly overflows. The tipping point might be one more infection, an illness, a significant exposure, an accident, or a major life stressor. Toxins that overwhelm our system can cause hormone dysregulation, neurotransmitter dysfunction, inefficient enzymatic and detoxification pathways, improper gene expression, imbalanced gut microbiome and function, disrupted gut, brain, and blood vessel barrier integrity, poor nutrient assimilation, and depleted mitochondrial energy production. Mitochondria are organelles inside the cell where all our energy, or ATP, adenosine triphosphate, is produced. Well, every step of ATP production can be impeded by specific toxicants and/or depleted cofactors, which are vitamins and minerals needed for the enzymatic reactions to take place. Mitochondrial energy is what drives our immune system. So without good mitochondrial function, nothing works as it should. When this happens, our immune systems, which were designed to manage all of these things, become overwhelmed and/or dysregulated, and inflammation sets in. We get fungal overgrowth like candida or yeast infections, bacterial overload and imbalance, otherwise known as dysbiosis, parasite imbalance, and pathogenic biofilms. Biofilms are thick protective mucousy layers that surround pathogens to protect them from harm. We also become susceptible to latent viral expression and replication. Because of these many factors, symptoms set in. Another point to mention, Our cell membranes, composed of a fatty lipid bilayer, are compromised due to a poor fatty acid balance or omega-6 to omega-3 ratio due to our standard American diet. If our cell wall doesn't have the right composition of fatty acids, we no longer efficiently transport nutrients into the cell and toxins and metabolites out of the cell. We also may lack proper balance of minerals so that we have poor voltage gradients across cell membranes, further disabling cellular exchange and cellular function. People with chronic challenges usually have a wide variety of toxic and pathogenic burdens. You can't say, oh, I have too many parasites, or maybe it's Lyme, or maybe it's mold, and think that it's only one thing you have to solve to get better. It might be all of these things, or a whole list of other things. We are each a symphony of multiple systems and processes. You need to take a multisystemic approach, both intrinsically within every bodily system and extrinsically, the things you can control and change in your lifestyle and environment. So, it's very important to cover all possible root causes in your journey to wellness. This is necessary in order to build immune resiliency so that you will remain well long after you complete your program. There's a very systematic and ordered way to approach this, and it requires intricate knowledge and mastery to make the process effective, efficient, and tolerable. Our program covers all possible sources systematically, comprehensively, and comfortably. You are probably saying, yikes, that's a tall order. How can I possibly manage all of that when I'm feeling so completely depleted by what I already have on my plate? Utterly impossible. Not so. Our program is designed so that you can do this. So you ask, what makes your program different to ensure that even I can do all of this? The way my program is designed, you'll get with my health coach and she'll guide you every step of the way in bite-sized pieces. She'll help you work each step into your life in a manageable way. She'll take you as fast or as slow as your body, spirit, lifestyle, and responsibilities are able to handle. Everyone is different. That being said, it's vitally important that you follow the directions of your coach so you don't cause yourself distress. That's where being coachable is a necessity. She'll hold your hand, cheer you on, answer your questions, and guide you. She will be with you as you handle the mindset challenges that you'll encounter along the way, and or guide you to the proper professional for more serious needs. Everyone with a chronic illness has a set of mindset challenges that go with the landscape. Maybe because of the stressors of being unwell, or maybe as precursors contributing to the wellness challenge in the first place. Any program that doesn't address this key element simply will not succeed. She knows exactly what to teach you to do each week so that your body will get through the process comfortably and successfully. She'll teach you how to effectively mitigate symptoms of detox if they occur. She'll give you a large tool chest of home remedies to use as you need them. This is what differentiates us from others. When you are doing this heavy lifting, you cannot and should not be left on your own. This process works, but because it works, you need to be working with someone intimately knowledgeable and experienced, because the risk of overloading your system is too great if left on your own without proper guidance. We are easily accessible for questions or concerns. This truly is a concierge service. How this process works. Next, I'm going to show you the components you must address in order to create balance between so many intricate systems. We get so focused on our symptoms that we often forget that we're much more than physical biochemical processes. The comprehensive expression of our being is a function of all components of self: physical, emotional or mindset, relationships and community engagement, and spiritual. No one can even fathom all the intricacies of our being. Psalm 139:14 states, "I praise you, for I'm fearfully and wonderfully made. Wonderful are your works. My soul knows it very well." It is vitally important that we address all aspects of self when it comes to addressing chronic symptoms. First, the physical. My philosophy is to guide clients in a comprehensive, systematic detox while instructing the immune system to reduce the pathogen load through the use of homeopathic symptom series kits. This is a very unique pairing, but awesomely effective. I am super excited to be on the cutting edge of this dynamic knowledge in the wellness space to really make a difference in my clients' quality of life. Let's talk about testing. It's very important to have objective data that, when combined with history, physical assessment, and symptomatology, will guide us in developing a targeted approach based on your goals. I'll teach you how to obtain your own objective blood and/or urine tests that will identify your imbalances, toxicities, and pathogenicity within a very high level of accuracy, also known as sensitivity and specificity of the test. Then we'll outline a very comprehensive and systematic approach that will target what you find, plus more. The following things must be addressed within an integral order of operations for successful outcomes. First, you need to correct the structure, the fatty acid composition, and function, which is the voltage gradient of the cell wall, to ensure good exchange of nutrients into the cell and toxicants and metabolites or waste products out of the cell. Second, you need to upregulate the natural drainage pathways of the body, including bowel, liver, kidneys, bile flow, lymphatic, glymphatic, which is brain drainage, lungs, skin, which is sweating, etc., so that toxins which are captured can exit the body without redepositing elsewhere. Third, you need to augment mitochondrial function, your cell's powerhouse, which is important for production of energy, pure water, and optimal immune response. Fourth, you need to optimize your innate detoxification pathways. And finally, complete a safe, well-tolerated, comprehensive, systematic, and targeted detoxification process to reduce the toxic burden on your system. If you remove the things that keep your immune system from working efficiently, you give it the opportunity to do its job and work properly without continuous outside assistance. Detoxification is a multi-pronged approach using natural substances and lifestyle practices that provide nutritional support, open up drainage pathways so toxicants don't get picked up and deposited elsewhere in the body, but rather exit the body through the many drainage pathways. Killers, which are usually specific herbs that destroy things like parasites, bad bacteria, biofilms, candida, and the like. Binders, which are products that bind strongly to toxicants to move them from the cell into drainage pathways to exit the body, while at the same time help to transport good nutrients into the cell. And homeopathic immune trainers. These are symptom series kits that instruct the immune system how to target specific pathogens, kind of like the way vaccines or allergy shots train your immune system to target specific viruses or allergens, but without adjuvant ingredients. The addition of homeopathic symptom series kits is really the icing on the cake. It's the genius of the process. You see, many resistant pathogens like Lyme carry surface proteins that morph and change to deflect them from anything in the environment that threatens their existence. It's like a camouflaging effect. Therefore, they resist antibiotics and even herbals to some extent. Plus, these pathogens like to hide deep in biofilms or in joints and structures where there is a poor blood supply, where antibiotics don't go. These organisms thrive in areas with poor oxygen supply. But unlike our vascular system that transports antibiotics, our immune system is without boundaries. It can go everywhere in the body and specifically target pathogens without resistance when trained to do so. When formulating your plan, we will lay out a timelined approach so you know target dates of addressing each step. However, keep in mind that everyone's response is different to each step and process. Therefore, we constantly remain fluid in this timeline, shifting it forward and backward as we go, depending on your tolerance and response. Some people can go faster and some need extended time. Sometimes life happens and we need to mitigate something that causes you stress during the process and then get back on track afterwards. This is the beauty of individualized coaching, as we can react to life as it happens. The purpose of our plan is to get you through to full independence and wellness maintenance. We teach you how to manage on your own once you're no longer with us. You will not be a client of ours forever, like so many other practitioners. Our goal is to help you get well and teach you how to stay well. Then we move on to another client who needs our help in the same way. We are not a revolving door or a hamster wheel of care. That being said, we love to stay in touch because of the relationship we've built with you, and we will be available for questions or needs. I kind of liken it to our kids. We raise them to become independent, productive, and healthy individuals. We want them to leave the confines of our homes and thrive, though we will love them forever. During your time with us, we'll also discuss topics such as food choices, eating habits, proper hydration, which includes quality and quantity of water, movement and exercise, breathing strategies, sleep and rest, clean household and personal products, and many other lifestyle habits. Your health coach will continuously equip you with a wellness toolbox that includes many different practical tips and tricks to augment your journey, deal with your symptoms, and help you feel better. You will be amazed with how weekly coaching is a complete game changer compared to working with a practitioner who doesn't offer this. Second, the emotional mindset and relational social, all of these being interrelated. We will provide you with tools for stress management, emotional regulation, mindset, and the importance of gathering and encouraging a personal support team. We'll help you discover mindset blocks or other things in your life that may be impeding your progress, and we'll coach you toward improvements in gradual and achievable steps. We'll encourage you, affirm your efforts and progress, and hold you accountable to your goals. We'll honor your personal individualities and choices, and we will point you to other resources in this realm if it becomes apparent that you need more help than we can provide. Finally, the spiritual. This very important aspect of our well-being cannot be ignored. In fact, in some, it may even be the priority. Things in life are unsteady, unpredictable, and constantly changing. But God's love is constant, non-stoppable, and everlasting. We will affirm your faith, pray with you, and speak to God's promises and His deep love and care over you. He is truly our rock. We are Christians and equipped to provide biblically based health coaching, but you may not resonate with this, or you may not want to delve into this arena. We will, of course, honor your choice. I hope you can see how we cover all aspects of addressing chronic challenges from the physical, emotional, social, and spiritual. When can you expect to see results? Most of our clients start to see wins and big shifts within weeks. If you're one who is here looking to optimize your wellness or prevent future problems, you'll of course move through the program much quicker than someone with chronic challenges, generally anywhere from 2 to 5 months. For those with long-term symptoms, some see big wins in short order, while others don't have significant relief until later in the process because the thing that's plaguing them the most can't be addressed safely until overlying layers are peeled off first. That being said, for you to get to the point where your system can reach and maintain homeostasis on its own, such that you no longer need constant coaching and intervention, takes time. They say it takes at least 1 year for every 10 years that you've been unwell. In our experience, the whole process generally takes about a year and a half for the latter group of folks. Some complete it sooner, and some need more time. No matter what, you can't expect to get better overnight. This process requires patience, trust, and dedication. Where will you be if you choose to work with me and my team? And I'll add, where will you be if you don't? What are you thinking at this point? What's going through your head? Some of you might be super excited and ready to get started right now. Others might be thinking, oh, I don't have the time or energy to do all of this. Or I'm stuck on all these meds. How can I possibly change that? Or I've put my hope and faith into so many other things, only to be disappointed. I just can't get my hopes up again and be let down. It's just easier to accept and live with my condition than go through the ultimate disappointment and dashed hopes again. We all have been in this place at times. Our minds are very powerful drivers of our actions. Well, if you never change course, you can never expect a different result. And honestly, if things haven't gotten better on their own in the past, they won't in the future either. In fact, they'll very likely get worse as you age and encounter more stress. We are skilled at helping you deal with your fears and negative thinking, helping you overcome them so you can move forward. We constantly strive to earn your trust in these ongoing mindset challenges. Another objection you may have is, I can't afford this because my insurance doesn't cover it, and it's likely expensive. Yes, this is an investment, but so is daily Starbucks, consistently dining out, expensive sports and vehicles, or taking a fancy vacation. In almost everyone's life, there's things you can temporarily sacrifice for a greater goal. After all, if this were your child or a loved one, wouldn't you do anything in your power to find the resources to cover it if you knew it would ensure a brighter future for them? Aren't you worth that too? Next, just consider the expenses that continued ill health will cost you in medical costs, the endless supply of medications you'll likely be on for the rest of your life, lost time from work, productivity, etc. We find that with our clients, once they're feeling better, the investment they made in their health is rewarded with much greater productivity and income earning potential. It's a trade-off that proves every time to be worth the investment in the end, not just financially, but also in quality of life. We also find that when people need to put financial skin in the game, they're much more diligent to stick to task and follow through. So what do you need to succeed? You just need these three things: the willingness to be coachable and to take action, to keep your focus on progress. You don't need to be perfect. Sustainable long-term results are built on bite-sized, consistent, imperfect actions. A commitment that you will never let your self-doubt stop you from having what you want out of life. Even if you've tried many other things that didn't meet your expectations, as long as you have these three traits, you can totally do this. Imagine what your life will be like when you can gladly say yes to someone who comes to you for help, knowing that you'll have the energy and strength to get the job done without it putting you down for days. Picture your life when you'll have the ability to remember, focus, and be maximally productive. Play with your kids in ways you never could before. Participate in sports or hobbies without pain and fatigue. Feel well rested and calm throughout the day, and have better patience and a joyful outlook on life. Imagine the legacy you'll give to your loved ones who have witnessed you overcome the greatest challenge of your life. One of my clients, who was always an avid blood donor, was barred from giving blood for several years before coming in my program because the blood center told her she tested positive for syphilis. This was extremely frustrating for her because her lab tests run at her medical clinic were consistently negative. Well, her lab tests during the first month of my program revealed that she had a very high level of Borrelia or Lyme antibodies. Her other blood center tests made more sense at that point because Borrelia actually mimics syphilis. You can't even imagine how elated she was when she returned to the blood center 15 months into her program with us and was told that all her tests came back clear and she had the green light to donate again. That was so very important to her. So don't fall into the myth that there's a one-size-fits-all program, or that you can do a simple detox or focus on a simple pathogen and think that you'll get long-lasting results. I hope I made it very clear to you that this has to be a multi-pronged approach that incorporates the physical, emotional, and spiritual. That you need an individualized approach based on objective data. That you need to work within a close relationship, one-to-one, with a coach who is super skilled and knowledgeable. That you need to take action or nothing will change. We've just covered some great stuff, haven't we? How many of you have found this content valuable? To be honest, an hour isn't enough time to give you everything. But let me ask you a question. How many of you would like to address your chronic wellness challenges for good? You came to this teaching looking for a solution, which is why I created a comprehensive program to help you gain momentum to achieve your wellness goals and get your life back. That leads me to my final how to get started. At the end of my presentation, you'll have an opportunity to book a free 15-minute discovery call with me. I look forward to getting acquainted with you, discover your wellness goals, and answer any questions. If you want to move forward, I'll show you how to sign up for my HIPAA-compliant electronic health portal, where you'll sign my contracts and complete a health history and assign symptom surveys. And I'll show you how to book your first appointment, called the Reclaiming Wellness Initial Consultation. At $200, this consultation is worth its weight in gold, as it's the very first step to getting you started toward achieving your dreams of all-day energy, easy mobility, little to no pain, and clear thinking. I will have summarized all your history and symptoms into patterns and systems in order for you to make better sense of things. As you share your story in depth with me, I'll clarify and modify my list. Based on your specific situation, we'll discuss what program is right for you and get you signed up and started. We'll also discuss options for lab testing, and I'll send you all the instructions for you to complete the tests. Once your results are in, you can book your review of findings consultation where we'll pinpoint your major challenges and devise a customized plan. I'm looking forward to spending time with you so we can imagine together what your life will look like after working with me and my team. Just imagine what it'll be like to create a customized path just for you, to build wonderful new relationships with others who will walk alongside you to the end, supporting you every step of the way. I encourage you to book your discovery call today. Don't wait and miss the opportunity. I've had a few recent graduates, so I only have 3 to 4 coaching spots for dedicated new clients. These spots are likely to fill fast, and I may not have additional spots available for quite some time. It will be hard for you to find a similar program. I will enroll the first 4 that are both willing to commit and demonstrate the qualities needed for success. Because I only have a few spots available, I'm only willing to work with people who are committed and ready to take action. We aren't looking for perfection, but only the willingness to find your inner strength, be coachable and goal-oriented. If this isn't you, then this program may not be for you. I still want to thank you for attending and wish you the very best, hoping you're walking away with new knowledge that'll help you in the future. As I mentioned in the beginning, I promised you a few wonderful free bonuses for staying to the end. First, I'll give you a resource that will better explain how to properly open the drainage pathways in the body and why order of operations is important. Secondly, I'll provide an explanation of steps that need to be sequentially addressed in a foundational detoxification program. These graphics, keep in mind, don't include the extra step of training the immune system with the homeopathic symptom series kits. This masterful intertwining of techniques is what really sets my program apart from others in comprehensiveness and success. Third, I'm giving you my essential oil guide called Symptom Support for Chronic Health Challenges. This invaluable resource offers you instructions on the use of 10 different essential oils to help you naturally manage everyday symptoms like pain, muscle spasms or cramping, inflammation, headaches, congestion, digestive discomfort and bloating, constipation, depletion, lack of energy, sleeplessness, vertigo, and emotions of depression, anxiety, stress, or overwhelm. There are instructions for supporting immune health and even how to use them as pure household cleaners. This guide also provides you with a suggested daily routine of essential oil use to support you throughout your day. I wanted to provide you with something extremely useful and meaningful as a token of my appreciation for you joining me here today. I hope that you'll make great use of this guide as it represents a lot of work developing it for you. I want to close with another testimonial from a client who has completed her program. Megan speaks of her experience in this way. It had been so long since I felt good. I forgot what it felt like. After so many years of consultations with different doctors and specialists and no answers, I lost hope that I would ever be able to resolve my issues until I met Diane. Since working with her, I no longer have sleep problems, brain fog, constant pain, infections, or weird sensations. I feel peace and calm instead of constant anxiety. The fire inside is finally quenched. It's so refreshing to be able to go all day without feeling distracted or overwhelmed. I have so much energy that there's nothing holding me back. It's good to finally live again. Developing this program has truly been a labor of love. I'm on a mission to transform people's lives who are dealing with chronic wellness challenges. This is my passion and calling. I've seen too many people suffer that don't have to be suffering. I want to make my education pay. In fact, I believe I have a responsibility to use the knowledge and experience that God has given me to help others. You'll be plugging into a community of people who will support you on your journey. We'll come alongside you to answer your questions and give you tools when you're struggling. We'll give you continuous guidance, encouragement, and affirmation. Invest in yourself. The money you spend on this program will come back to you both in increased energy, productivity, and income earning potential, but also in prevention, saving you manyfold the cost of future expenses that will be the result of not working with us. If your well-being hasn't improved on its own by now, it's not going to get any better unless or until you take action. In fact, I hate to say it, but it's likely to get worse. So, as I see it, you have two choices. You need to pick one of two paths. One path of non-action resulting in no change, or worse, or the path of a transformed and bright future, one that you could barely even dream to chase until now. Trust me, I fully understand what it takes to make a life-altering decision. In order to pursue this passion and calling on my life, I had to make my own decision between two paths. I absolutely loved being a PT, and I was good at it. Being a good manual therapist is like an art. You need to pull from your resources of knowledge, reasoning, and problem solving. But there's also an art of instinct that you only develop after many, many years in the field. I had reached that level. In many states, PTs can incorporate functional medicine into their practices, but in my state, I need to keep those practices separate. Because developing and maintaining a business is all consuming, I realized that I couldn't effectively do both. So I gave up my practice of physical therapy because I truly felt that I could make a bigger impact on the overall wellness of my clients addressing health comprehensively in this role. Once I made that decision, I dove in headfirst and put everything into it so I can help the most people in the most impactful way possible. The more I help people truly transform their lives from a state of disability to fully thriving makes this decision so worth it. My point is this. This is what you need to do. Make a decision and dive in with everything you've got. It's so easy to start. To schedule your discovery call, just click on the link in the chat or in the invitation email that I sent you. You'll be directed to my Calendly page where you can schedule your free discovery call. Look, you've had chronic wellness challenges for a long time. You want to have more energy, less pain, better mobility and stamina, and a brighter outlook on life. If that's you, then click on the link. I am so grateful that you joined me here today. Thank you for your time and attention. Again, my name is Diane Lapota from Diane Lapota Foundational Wellness. My website is dianelapotawellness.com. You can reach me at diane@dianelapota.com. I look so forward to meeting you and brainstorming together all that is possible for your future. Just click on the link and book your free call.